Hi, everyone. Thanks for tuning in. How are you doing today? We're going to be talking for a minute about fear of pain. Uh, and I'm going to be sharing a recent experience I had related to sickness. I still have it. You can hear the sickness. I still have a sore throat. I've had this, I don't know, some virus over the past week. And um, and so I had an interesting experience related to pain and want to share that. And what you will get from by the end of this live is some perspective about pain and how to manage pain, how to experience pain in a way that is more pleasant. Could I possibly use the word pleasant and pain in the same sentence? I did. I did. Um, with the caveat, with the condition of the word more, okay? A relative increase in pleasure. Not saying that pain is ever pleasant. What I'm saying is that you can make the experience more pleasant. So let's talk about that. Um, and this is going to apply to any type of pain. Pain is really complex. There's many different forms and types, and I often think I often oversimplify pain into two categories of acute pain or chronic pain. Of course, those are two legitimate categories, but there's also many more complexities related to pain. And so my objective now is not to address and discuss all the complexities of pain. Um, this experience I had and what I'm going to share is going to help you no matter what type of pain you're experiencing. Because what I'm sharing is not a solution for pain. In order to solve for pain, you first must diagnose the pain. You must deeply understand the complexities of it and what type of pain you're experiencing, all those things. And that's not what we're talking about now. What I'm talking about now is when you experience pain, regardless of the type of pain. And I am speaking specifically of physical pain because I know sometimes when I use the word pain, I'm referring to any discomfort, whether that be emotional or physical. But right now, I'm honing in on physical pain, physical discomfort, physical pain. Um, so when you are experiencing some physical pain, what do you do? And first of all, ac- acknowledging what happens to you emotionally. All right? What happens emotionally when you're experiencing physical pain. That is really what I'm focused on today. Your reaction to pain. And why, if that's not solving for the pain, why is it even useful to talk about? Well, because the physical pain might not be solved for, but your experience of the pain can change when you pay attention to your emotional reaction to the physical pain and you increase your awareness related to your emotional experience, you then gain ability. You increase your ability to influence your emotional experience, which can also impact how you experience the physical sensation, how you are interpreting that physical sensation. That all can change. All right. So here's the experience I had recently. Um, this virus has brought a lot of aching, a lot of pain, a lot of physical pain, body aches, and sore throat and headache. Those have been the main symptoms I've had from this virus. Common, nothing super concerning. Um, and on one of the days, I was having, um, like, when I was having these body aches, it was more acute in my lower back. And for whatever reason, I could go on a whole tangent about why that might have been, and that's besides the point. um, so we'll just say for purposes of this conversation, pain in my lower back, and I um I laid down. I was in the middle of work. I was trying to get some work done, but I'm like, you know what? I'm in a lot of pain. I have complete body aches, and I'm just gonna lay down. Um, and I lay down, and I wanted to rest for maybe um 30. I can't remember. It's 30 to 45 minutes, something like that. I'm like, I'll just see how I do after 45 minutes. But as soon as I lay down, I kind of have this urgency. I'm like, I'd like to sleep. I'd like to have a very restful 45 minutes and hopefully maybe get back to work. Um, so uh, that's fascinating, right? That's one fascinating point in and of itself is how we react to pain. Um, is is it a way that is offering ourselves space and time to rest or to experience safety? Or are we reacting in a way that increases anxiety or increases stress? So, my reaction here that I'm describing was one that was increasing stress. I was creating pressure right away. I'm like, I'm going to rest, but only for 45 minutes, and I hope it's effective. And so, to effectively rest for 45 minutes, I got to get to sleep. And so I lay down and I'm like trying to get to sleep, submit to sleep. And there's, meanwhile, all of this pain in my entire body. Like, whew. And I'm laying there and I breathe and I'm like, ouch. Does this sound familiar? If you experience pain from sickness or maybe of chronic pain or other type of pain, maybe this is sounding familiar in some way. You're like, okay, I I I want to relieve some pain or at least just relax for a minute. But ow. This hurts. And as I'm laying there, I'm thinking like, man, as long as I have this pain, how am I going to sleep? So then I'm like feeling some anxiety. I first create some pressure into the situation. I'm like, I gotta have an effective 45 minutes. And then I lay down. I'm like, oh, this isn't working. How am I gonna have an effective, restful 45 minutes when, ow, I'm hurting? And so then I start to have some anxiety. I'm like, shoot, this isn't working. Okay, notice all of this is my own reaction, my emotional experience in reaction to the pain. All right. Um, the next thing that happened was I bring my attention to my lower back. And I'm like, my lower back is in extreme pain. Oh my word. Why is my why is my lower back hurting so bad? And then I'm like, oh shoot. This is bad. Like there's something bad happening in my lower back. And and then I what I'm I started to experience this. I'm like this alarm of danger. I'm like, there's some danger, and I started to imagine this sounds crazy. This sounds extreme, but maybe if you've experienced it, it's not so extreme. But I bring it up to increase our awareness of it. Are you aware of the extreme places your brain goes? If you're not, um, the objective here is to encourage you to allow um, to allow the extremity. It's like it's okay. understand what extreme reactions you're having. Because the first step to change your experience of the pain is to understand what your emotional reaction to the pain is. So I'm laying there, I'm like, oh my word, I start to have these alarms, emotional alarms, danger, danger. And actually, that's not how it sounded, right? I'm kind of putting some narrative to the experience, but what the experience was is it was just imagery. I am laying there, I am experiencing the acute pain in my back. It's all over my body. I have full body aches, but then it's more acute in my back. And as I'm noticing that, I start to have images. And the images were, um, it was like a beam. The only way I can describe it is like maybe a beam or a steel bar that snaps. And that beam or steel bar is representing my body, and the snapping is happening at my lower back. And it gets so extreme that I'm like, that beam or that bar snaps. And if that snap is so powerful, it might actually detach. Okay, does this sound crazy? It's not crazy. It's not crazy. This is what our brain does. We have images, and I had an image of my lower body detaching from my upper body. Okay? Let's normalize this. I'm sharing this to just normalize it because you might be having some type of imagery like that related to your pain, but you're ashamed to even admit it. You're like, oh my gosh, that is so ridiculous. I'm telling you, it's not ridiculous. We have some very powerful imagery that takes place in response to pain. It is what our brain is designed to do. Why? Because survival is so paramount. Survival is so embedded into our operating system, our nervous system, the workings of our brain. And so, over time and with evolution, our brain is wired to give us that kind of imagery when experiencing pain. Why? Because often pain is a signal of danger. And our brain is like, our brain is expounding on that. It's escalating that. It's making it even more vivid and real for you so that you can respond. And that response that the brain cares about is one that will um, support survival, right? That's what the brain is concerned about. And so it's extremely normal. It's okay. And it's extreme. I'm acknowledging both. It's normal and it's extreme. What is that extreme reaction for you? Next time you're experiencing pain, I invite you to really just pay attention, get so curious. Is there imagery that comes up? Or are there words that come up? Or is there a memory that I experience? There's some type of reaction. It's there. And when you can normalize the reaction is normal, the reaction is okay, then you now become equipped to change your experience of the pain. When you are not normalizing the reaction, you're just having the reaction, and you are almost like you're a passenger of on a roller coaster, and this is just happening to you, and you are thinking it should not be happening. You're now being subject to the pain. Subject to the fear. You're being absolutely subject to the fear, and you're creating more fear. On the other hand, when you normalize it, you're like, oh, here's that extreme reaction. That is what my brain is wired to do. It's okay that I'm having this extreme reaction. And I know that it is an emotional experience. I know that it's not representing real danger. Sometimes maybe it is. That's a question you have to ask. Is there real danger here, right? In my case, when I'm laying here and I'm trying to rest and I'm creating this urgency, so all of those factors, the pressure, the urgency for me to rest in 45 minutes, and then like that may have added to the imagery, right? That may have added it escalated my nervous system. It heightened my fear response. And so from that heightened place, my brain created these very vivid and powerful and fear inducing images. And as soon as I saw that, I just like was like, wow, this is my reaction. This is what I've learned to do over the past 5 years. I respond with fascination. We have this reaction, and then we get to respond to that reaction. Does that make sense? We have fear, and then a reaction to the fear, and then our response to that reaction of the fear. And so my response that I've practiced is fascination. And so I have this reaction and this imagery, and it's all normal. It's what the brain is wired to do. I'm like, and when I know that it's all normal, it's easier for me to get to fascination. I get to fascination. I'm like, oh, wow. Look at what my brain has done. It has created imagery of this beam that has snapped, and it snaps, and it's so extreme that it detaches, and it is associating that with my body. My brain is imagining, it's creating this imagery of my upper body separating from my lower body. That is so fascinating. And when I get to fascination, that creates safety. It creates some safety. It creates some lightness, right? Instead of me now being subject to that reaction and being caught up in it and escalating it even further, I now am um I am let's see. What's the way to describe this? um I'm I'm creating. I'm it's like this storm is happening, this reaction is happening, and I'm stepping outside of it, and I'm viewing it from a place of safety. I'm stepping outside of it, and I'm viewing it from a place of safety that creates some calm. There's not complete calm. Like, um, there's still the reaction, and it's so fearful, and it's this extreme concern about my lower back and my body and this danger that I'm in. That's happening, and simultaneously I'm watching it with fascination. I'm like, wow, look at what my brain is doing. This is so interesting. This is wild. What a powerful image, and what a fear inducing image this is. Like, wow. And I feel that fear, and I experience it in my nervous system. And so I'm narrating, and I'm just watching my fear of pain. That is the process. So in some way, I hope this offers to you some language, some tools, some ways that you can become an observer and possibly react with fascination to your fear of pain. Because fear of pain is in us. It is what our brain is supposed to do. It is wired to, it is supposed to be fearful of pain. But what that does not mean is that we must fear pain. We get to respond to that fearful reaction to pain. We get to respond, and we can respond with reassurance that we're safe, with fascination, with curiosity, with calm. When you practice that response to your fear of pain, you gain power. You increase your ability to experience your pain in a new way. So go and have at it. Next time you experience pain, watch that fear of pain come up and see if you can't be a little more fascinated with it this time. That's what I have for my friends. Thank you so much for tuning in. I love you all so much. I appreciate our community. And I look forward to connecting again next time. Please feel free to share any comments. If you like the notes or like to get my weekly content over email, there's a link there. ChandlerLifeCoaching.com/more content. I will speak to you next time. Bye, everyone.